Hello, everybody. My name is Dr. Denis Gomez, and I'm aesthetic physician in south of France at Nice. And today we're going to talk about innovative procedures targeting androgenetic alopecia using with Cellbooster Hair. So this webinar is going to be organized and funded by Swissell. No, could you come back? Yes, thank you. My name is Dr. Denis Gomez, and I declare today a conflict of interest as a speaker for this webinar. The clinical cases and protocols I'm going to present you today are representing the current medical practices of myself, and Swissell cannot recommend for the use of its products of the approved instructions for use. And please, images and photographies today are the courtesy of myself and also of Swissell. Next. So, as I told you before, my name is Dr. Denis Gomez. I'm aesthetic physician at Nice, south of France. I'm the founder of my own clinic, Renaissance Clinic, which is opening in October the 6th, 2025. I have a background in advanced aesthetic medicine and moreover on hair restoration for more or less 8 years. And I was working more than 4 years at the Clinique des Champs-Élysées at Nice. Next. So the agenda for the webinar today, we're going to see in 3 parts. First part about hair biology and all the current therapies for hair disorders. In a second and middle part, we're going to talk about the CHAC technology, which is the heart of Cellbooster products. And in a third and last part, we're going to talk about the strengthening hair with products Cellbooster. First of all, about hair anatomy, I wanted to share with you today the fundament of the hair anatomy. First of all, the hair shaft. Hair shaft is composed of keratin. It is, of course, the visible part of the hair above the scalp. You can see directly when you have a patient in front of you. Just below the hair root, located within the skin, surrounded by the hair follicle. The hair follicle, this is a dynamic structure responsible for hair growth. This part includes the bulb, the dermal papilla, and the surrounding sebaceous gland. We're going to see on a picture just after. As I think everybody knows, the hair growth is for 3 parts. First part is called anagen part. It's the growth part and more or less lasts between 2 and 7 years. The second phase is a catagen part. It's called the regression part of the hair. It's a transition phase from more or less 2 to 3 weeks. And the last one is a telogen, the resting part. This is a hair shedding, more or less prepared for 3 months. So as I told you just before, this is a picture of a normal hair follicle. You can see the deeper part is a bulb, just up the suprabulb, then the isthmus, then the infundibulum. This is all the part under the skin. This is the part we don't see when we examine our patients. About the hair growth, 3 parts. We have the first one, anagen phase, then catagen, then telogen. In a normal hair growth, normally we have a high anagen part and a minimal telogen part. This is a problem with, for example, AGA, androgenetic alopecia, where we can observe a diminution of the anagen part and an increase of the telogen part. We're going to see this just after with more precision. This is a picture, a schema of about keratin production. So from the first DNA with a transcription step, we obtain the mRNA, and just after the translation step, we can observe the work of the ribosome to produce an accumulation of amino acids. And the accumulation of all amino acids create the final keratin protein. Next. This is a picture of hair structure. You can see the accumulation of amino acids that create the keratin protein. Keratin protein is the main structure inside the hair. You can see the tetramer that give intermediate filament, then microfibrin, then macrofibrin, and then the final hair with 50 micrometers. What about now the aging and hair? What are the clinical problems? You can observe with your patients in your practice that with age, both men and women can experience physiological changes in hair. You're going to see hair thinning. This is a progressive miniaturization of hair follicle. You can observe a reduction of the hair density, as I told you before, is due to the shorter anagen part and an increase of the telogen hair. You can also see changes in texture. Hair become drier, more fragile, thinner, and less pigmented. Androgenetic alopecia, we have to know, are common for men and also women, caused by many causes as genetic and hormonal factors. Delayed hair regrowth, of course, when we have a slower turnover of the hair cycle, we can observe more hair loss, less density. And with scalp changes, of course, with the age, we have a reduction of the vascularization and a reduction of sebaceous activity that create real clinical problematics. What are nowadays our patients' expectations? When your patients come to see you in consultation, they have a real psychological impact because of hair loss that often affects self-esteem and confidence, of course. Moreover, I think is the case in your practice. In my practice, patients want and desire non-invasive and effective treatments. That's why it's important in our practice to offer to our patients non-invasive and minimal invasive treatments and, of course, effective treatments. We have nowadays in our practice many different therapeutic strategies like PRP, like laser, like LaserMD Keralize. We can use exosome, polynucleotide, mesotherapy. And of course, when all those treatments are not effective, or if your patients come to consultation to you and have a real hair loss or like bleeding, of course, we can advise directly like FUE hair transplant, for example. About the hair aging, so we have many causes: genetic defects, systemic disease, UV radiation, nutritional imbalance, environmental pollution, and physical damage. result, we have normal pigmentation, hair graying, we have hair cycle arrest, impaired HS attachment, we have hair loss. We will have HF miniaturization, we have hair thinning, and structural and functional change in hair protein, we will observe a structural damage. What about a normal hair follicle? As you can see on the left part of this slide. You know, in androgenetic alopecia, you will have effect of testosterone, but not only testosterone, it will be the product of the progesterone. This is called DHT, dehydroxytestosterone. And we know that DHT have a real effect, a real negative effect on the hair growth. It is a case, for example, as you can see on the right part, alopecia areata. It's called, for example, pelade. It will have an effect on the bulb, or for example, scarring alopecia will have effect on the bulge. AGA, androgenetic alopecia, as known as male or female pattern hair loss. First of all, is a genetically predisposition, progressive and non-scarring form of alopecia. It results from the progressive miniaturization of hair follicles, influenced primarily by androgen, and as I told you just before, especially the production from testosterone, which is called dehydrotestosterone, DHT. This is a variety of genetic and environmental factors. First of all, hormonal mechanism. The DHT is a metabolite of testosterone converted by an enzyme called 5-alpha reductase, type 1 and type 2, binds to androgen receptor in dermal papilar cells. In genetically susceptible individuals, DHT induces shortening of the anagen phase, prolongation of the telogen, the resting phase, miniaturization of hair follicles, and reduction of follicular density and follicular diameter. About hormonal genetics, we can see genetic predisposition. In many scientific studies, we show that AGA is polygenic with contribution from RR gene polymorphisms in the X chromosome and other lothian. We show also that follicular inflammation and microenvironment can have a bad effect on the hair growth. Perifollicular inflammation, oxidative stress, and alterations in extracellular matrix may contribute to disease progression. Increased expression of pro-inflammatory cytokine like TGF-beta1 and WNT-beta-catein pathway inhibition impairs follicular regeneration. And moreover, really important to know that vascular and nutritional factors are an influence on the hair growth. The reduction of vascular endothelial growth factor, the VEGF, expression impairs in microcirculations around follicles, and decreased blood supply may lead to follicular hypoxia, of course, affecting follicle metabolism and cycling. As I told you just before, microinflammation has a real negative effect on the hair growth. So what we want when we treat our patients is to focus and to have less inflammation and have a better vascularization of our follicle. About the nutrition deficiency, of course, if you miss nutrition like vitamins, like amino acid, like hyaluronic acid, you can have dysfunction of the hair growth. So this is important also when we treat your patient to see and to think about giving and add nutrition on the hair to have better hair growth. So important to know it. Nowadays, about the current therapies, this is a slide where I wanted to put more over all the techniques we can use nowadays in our practice. First of all, about the drugs. You know, drugs like finasteride, dutasteride is a good medication to stop the transformation from testosterone to dihydrotestosterone. Very good medication, but as you must know, with very side effects like depression, like sexual disorders, we have to inform our patients. Second drug is minoxidil, very effective, less side effects that finasteride and dutasteride. It is a local application, or you can take like pills directly with risk if it's a local application of irritation of the skin. And if you take minoxidil by mouth, you have a high risk. We have to tell our patients high risk to have a stimulation of the hair growth on all the body, not also on the scalp of the head, but on all of the body. About other therapies except drugs, we can see supplements, vitamins you can take directly by mouth. We can use polynucleotides, exosome. We can use laser, like LaserMD Curalas. You know about PRP. PRP, you make a blood extraction. After that, you make a centrifugation and you take off all plaquette to re-inject. This is a very good treatment. Microneedling, I think everybody knows, it's a way to stimulate, to have a mechanic stimulation of the hair growth directly on the skin. And of course, mesotherapy, we're gonna focus about that just after. So we can give our patients a lot of treatments to answer their problem. We can use monotherapy, like only drugs, minoxidil, finasteride, but we show in many studies that combining therapies are more efficient. And combining therapies targets multi-pathogenic pathways simultaneously. So that's why I think in our practice it's very interesting not only to propose isolate treatment, but combination of treatment. So I make this slide just to give you an idea of what you can mix and what you can use together for having a better benefits on the hair problems of your patients. First of all, about finasteride and minoxidil, you create hormonal answer and a vasodilatation of the valves just around your follicle. So this is a good combination. What about microneedling and topicals like minoxidil, PRP, exosome, or mesotherapy? The microneedling allow us to have a better penetration of the topicals. So finally, you can use microneedling with about more or less all the topicals to have synergistic follicle activation. What about laser, LaserMD and Curalas? I don't know if it's very famous in your countries, but in my practice in France, that can be the same case in Spain, Italy. We use a laser. This is LaserMD. It's a non-ablative fractional laser. It's like a microneedling, but without needles. And after the use of your LaserMD, we can introduce Curalas. Curalas is Cura factor. It's growth factor. We can insert directly in the skin. You don't need needle. It's not painful. And this treatment really improves compliance because patient doesn't feel pain. So he can come back in your clinic to do it again because it was not very aggressive for him. What about PRP and microneedling? Very useful technique in many countries. It allows us to have a boost efficacy and follicle regeneration by the use of growth factor. So very, very good combination. About hair filler, I don't know if you use Dr. Siege. Dr. Siege, it's how say biomimetic peptide. It allows you to have a mimetic of the action of all the growth factor under the skin. And the lead, of course, it's photobiomodulation that increase the penetration of the products into the skin, and light therapy also stimulates the hair growth. But we have to use and to make many sessions to have a real effects. But no pain, no needle, so interesting also for the compliance of your patients. What about finasteride and mesotherapy? Very good combination because you have the hormonal effect and a cellular regeneration. So it's a dual mechanism. This is interesting. I use a lot this combination, especially for men in AGA. About mesotherapy and LAID, this is a very nice combination. I also use many times in my own practice that allow to have cellular regeneration and photobiomodulation in the same time. We have a nutrient supply, and it is important because we're going to affect and increase the anagen phase reactivation. So good combination. And last one, as I told you before, if you have no effect of all these therapeutics before, or if your patient is very bored at the beginning, you can offer a surgical solution like surgical transplant, hair transplant with FUE and DHA, and FUT hair transplant. This is, I think, for me, according to me, the last solution if you have no solutions before. This is my reference here, you will find. I wanted with this slide to focus about exosome because exosome is a very, I think in France, in our practice, it's a new treatment we can offer to our patients. Exosome, just to know, it's a nano-sized extracellular vesicle, which is naturally secreted by cells, and especially stem cells. Exosomes are interesting because they serve like intercellular messengers, like growth factor, cytokine, RNA, and lipid and protein. So exosomes are really interesting, and we show in many studies that they modulate cell behavior, they create a reparation of tissue, and they can give an immune response without introducing live cells. But the mechanism of action in regenerative medicine, this is interesting. Exosomes promote angiogenesis, so new blood vessels. Exosomes will activate resident stem cells. They reduce inflammation. They give an anti-inflammatory answer. They stimulate fibroblasts and keratinocytes, enhance collagen and elastin synthesis, and very good information. They modulate the immune system. And of course, they protect against oxidative stress and apoptosis, increasing the anagen part at the same and decreasing the telogen part. So it's an increasement of the hair growth. Like you see on this slide, exosome we have many effects on the synthesis of collagen elastin by stimulation of fibroblasts, by inflammation reduction, and by a real increase of the hair growth. I just made this slide. This is interesting, I think, for you to understand the difference between exosome and mesotherapy. Exosome, as I told you, it's cell-free biologic derived from cell cells. In the other side, mesotherapy is a cocktail of ingredients. We're going to see just after which ingredients. So exosome, about the mechanism of action, they recreate a biological messaging. Mesotherapy is nutritional stimulation, not the real same action. About the target effect, exosome will stimulate follicular stem cells, regeneration, inhibition of inflammation, and reactivation of anagen phase. In the other part, mesotherapy, by the nutritional supplementation, they boost scalp vascularization, improve the keratinocyte and fibroblast activity, and provides local DHT inhibition. What about the duration of action? Exosome will have a long-lasting signaling effect, like between 2 and 3 weeks after every session. What about the mesotherapy? It's a local metabolic boost with, we know, shorter biological duration, and we will see just after how many times we can have effect of mesotherapy. How can we use exosome and mesotherapy? Exosome, in France, in our practice, we cannot inject by needle. So we have to use a way to introduce exosome into the skin. We can use laser, like LaserMD, or needle with microneedling, but we cannot inject. I don't know if your country, how you use exosome. It is interesting. We will talk about this after the presentation. Good to have exchange about your practice with exosome. So mesotherapy is superficial micro injections into scalp, and we will see just after the technique of injections. So results with exosome we'll see more or less between 4 and 8 weeks, and the mesotherapy between 6 and 10 weeks. What about the protocol? I put, for example, those two protocols, but it's very different about the studies you can find. So this is what I found globally we can do. In France, exosome, it's more or less between 3 and 6 sessions with 2 to 4 weeks between each session, And about mesotherapy, between 4 and 8 sessions, spaced with 1 to 2 weeks. Exosomes are, as I told you, excellent synergy with laser, with keralase, with plasma, and with light therapy. About the same for mesotherapy, we can have and see a good combination with all the treatments we saw before. Exosome, not really painful because you don't use a needle. You can use laser like LaserMD, but it's not painful laser. And about mesotherapy, it's injections, so it's good tolerated. But if you have, for example, patients that don't like needle, they can be a little bit scary for them, but not really important. So we have to reassure about that. About the cost, exosome, yes, it's a little bit painful because the products we buy are really painful. So when we want to sell our patients, it's a high price. About mesotherapy, not really expensive. Okay, so now we're going to focus more about the products, what is interesting today about the Cellbooster Hair. Cellbooster Hair is a HA innovation, patented technology. We have many scientific publications about its use, and very efficacy and very safety with no side effects I observe in my practice. What about the SHAC technology? The SHAC technology, it's a technology that creates Swiss cell with all the products of Cellbooster Hair, shape, and the lift, and the other one. So this is a technology we can see in all the products, not only with Swiss cell hair. This is a certification. It's a unique complex ingredients and combination. This is a no chemical binding agent. It's very important to know it. And this is a gradual and optimal release of active ingredients. We're going to see it after. So you can see in the middle of this slide, it's a molecule of hyaluronic acid. This is a hyaluronic acid matrix. This hyaluronic acid matrix is going to have like pressure and a shear deformation by mechanic effects. On this hyaluronic acid matrix, we're going to add just after molecules. Next. Okay. Like vitamins, like amino acids, we have integration of active molecules. And what we have to understand, this is the hyaluronic acid matrix will be like a vehicle to have a better penetration into the cells of all amino acids and vitamins linked to this molecule. This is a 3D stabilized complex, and all this complex of hyaluronic acid matrix, amino acid, vitamins, or integrated active molecules will give like final result an activated cell booster. And it allows, it's very important to know about that, it's with this integration, it allows to have also a longer answer, a longer effect of all integrated active molecule that is not the case of other concurrent products. About SHAC technology, the key advantages, as I told you before, no chemical binding agents like BDDE. No, we don't observe. You have a gradual and optimal release of active ingredients and so unique complex ingredients and combination of Swiss cell. So about Cellbooster Hair, we will find stabilized hyaluronic acid matrix, vitamins, amino acids, and oligoelements linked directly to the hyaluronic acid matrix. About hyaluronic acid is 18 milligrams, but the concentration. Amino acid, you can have B3, niacin, vitamin B5, pantothenic acid, B6, pyridoxine, B7, this is biotin, B12, cyanocobalamin, and vitamin P, it's butene. What about amino acid? You will find arginine, cysteine, glutamine, glycine, lysine, and also copper and zinc. The main indication of Cellbooster Hair, like the androgenetic alopecia, it's non-cicatricial alopecia. Of course, if you have a cicatricial alopecia, you will not have answer with mesotherapy and all the treatments. It's good indication in damaged hair shafts, AGA, androgenic alopecia, and premature graying. First of all, about the hyaluronic acid matrix with SHAC technology. It's a stabilized hyaluronic acid, 18 milligrams per vial. We have a high rate of concentration. Efficient delivery, optimal vehicle, as I told you before, to have a better transportation of all the active molecule linked into the cells, prolonged bioavailability, high tissue hydration, and a mechanical cell resistance. What about the vitamins? Vitamins B3, B5, B6, B7, B12, and routine vitamin P. Its active ingredient with HA, prolonged bioavailability. About the biological function, hair growth, hair pigmentation, development of hair follicle, anagen phase stabilization, apoptosis prevention, antioxidant, and hair elasticity. What about amino acids? Arginine, cysteine, glutamine, glycine, and lysine. What about characteristics? Actives integrated with hyaluronic acid, prolonged bioavailability. About the function, hair growth, prevention of hair loss, better hair strength and hair cuticle structure improve, antioxidant, and iron enzyme uptakes. What about oligo elements? Zinc and copper. Its actives integrated with hyaluronic acid and prolonged bioavailability. And about the biological function, we have a decrease of hair loss, we have hair growth, decrease of premature graying, and effect on hair pigmentation. So Cellbooster Hair is a real interesting method therapy to boost hair vitality and to help in our practice, help our patients to answer all the problematics we can observe. It's keratin production with vitamin zinc and kriv. You have hair strengthening with all amino acids. And of course, we have a nice and clinical observable hair growth. So this is a very strong support for hair regeneration, stimulation of cell and follicle activity, replacement of damage, restore hair function, and improvement of hair vitality. So Cellbooster Hair, what's the effect? What's the target? Nourish scalp and fortifies follicles, acceleration of hair growth, and of course, prevention of hair loss. What was the protocol? This is the protocol I use in my own practice. I do minimal 6 treatments. It can be more, but I do minimum 6 treatments with 2 weeks. I do 2 weeks between each sessions. This is aggressive initial beginning protocol. And after, to maintain the results, I do in my practice 1 session every month. What about the injection techniques? We can use micropapilla with needle. We can use with microneedling. We can use with laser, like LaserMD. We can use with a nail patch, like a very quick technique on all the scalp. And about the technical, we have the needle and we do an angle of 30 degrees to inject. And I do like micro bolus every 1 centimeter. Now we're going to focus a short time about this interesting study with Gabriel Siquier and Dr. Timur Taskesen about alopecia, scalp alopecia treatment with the use of combination of Photona, laser, and Cellbooster Hair. Very interesting study where they use a fractional non-ablative laser. It's a Photona hair restart laser to have little and a slow aggression of the scalp, waiting 15-20 minutes after, and just after the stimulation with laser, we use Cellbooster Hair with injections technique to insert mesotherapy inside the scalp. About other clinical studies, we're going to see now. I think it's not very new for you. This is very famous studies on Cellbooster Hair with Shack technology. The first one is a very vitalizing effect on the scalp after injection with mechanically stabilized hyaluronic acid complex in subjects with AGA, androgenetic alopecia. And we can observe in this study a real improvement of hair shine, hair density, and a real effect on hair loss and hair thickness. Methodology was to do 6 sessions of injections, and we will observe the result after D90, after the beginning part of treatments, and very nice effects on all patients' problematics about density, improvement of hair density, about shining, improvement of hair shining, with thickness, improvement of hair thickness. And we measure the result with subject patients satisfaction, with global aesthetic improvement scale, and with other technique like proscope, like a camera to see to measure the effect, and a glossimeter to see the effect. We can so see with this study a nice improvement, but also no side effects and good tolerance of patients after every treatment. About density, we observe more 26% of density at day 90 after a protocol of 6 sessions. So very, very significant benefit of cell booster injections. About less hair loss, we observe a real significant diminution of less 54.9% of hair loss after a full protocol of 6 injections. So very, very significant effect on that part. And about strength and resistance of the hair, we observe an improvement of more 37.5% about thickness. So very, very significant and benefit effects on strength and resistance hair. Confirmation, of course, of the improvement of hair thickness by a proscope. So we saw an improvement of more 9.4% on thickness. So also a very significant benefit. This is after the protocol, beginning protocol of 6 sessions of injections. Now we will observe like a picture before and after on patients. We're going to see both results of a Swiss Cell laboratory and at the end results of patients I treated in my practice. In this first slide, you can see after a protocol of 6 sessions of injections, a nice and a significant improvement of patient's hair, better hair density, and a better improvement on the hair loss and improvement of hair thickness at day 90 after protocol. This is another slide where you can observe a significant improvement, a huge benefit after protocol of 6 sessions of Cellbooster Hair injections about density, thickness. Very nice. It is a frontal part, also a nice improvement after 6 sessions of injections. The result after 90 days, beginning of the protocol. So you see a very, very nice improvement on the density and thickness. This is a vertex part of this patient. Also, nice and significant improvement after 6 sessions at day 90. We can observe better density. The same for this patient, better density on this part of the head. So we can say that we have nice improvement on shine, on hair loss, better improvement on thickness, better density, and this is due to the concentration and due to the shock technology of this product. Other cases. Now we're going to see patients in my practice. It is a nice woman I treated with alopecia areata. I did 5 sessions. It's a combination treatment of 5 sessions of Dr. Sige. It's domimetic peptidal with 10 sessions of Cellbooster Hair, and I did a protocol of 2 weeks between 2 sessions of mesotherapy, then Dr. Sige mesotherapy, then mesotherapy, then Dr. Sige mesotherapy. We did this protocol and very nice result. And I saw her, it is 3 years ago I treated, and I see these patients now every 3 months to do every 3 months 1 session of Dr. Sige Cellbooster Hair and Milta Head. It's a light therapy I use in my practice. Another one, alopecia areata. Also, I did the same protocol of 1 session Dr. Sige Cellbooster, then 1 session mesotherapy, then 1 session combination, etc. 10 times, and also with maintained treatment every 3 months. I use 1 session Dr. Sige Cellbooster and light therapy. So we have a very good answer in alopecia areata with autoimmune problems. So not only AGA, but also in this kind of alopecia, very, very nice effects. This is a patient I treated on the back part. I did 3 sessions of Dr. Sige and 6 sessions of Cellbooster Hair mesotherapy and 6 sessions of light therapy, and we can observe a very nice improvement of the hair density. And now I see him to have maintained effects every month. Every month he comes to see me since for 2 years to do every month 1 session of Sige Cellbooster and light therapy. Other case, in this patient, I only did Cellbooster Hair. I did first part of 6 sessions of Cellbooster Hair with light, Milta Head light, and I see him every 3 months to do 1 session of 2 vials of Cellbooster Hair every time. And other patients, while I use a combination of exosome used with microneedling. I use in my practice exosome ASCE-HRRV, and I use with a combination in the same time of Cellbooster Hair injected directly with needle, and just after I always do a light treatment with Milta Head therapy. Thank you everybody for being here today. To a better conclusion today, we can say Cellbooster Hair is very nice product to be used or alone or you can use, and this is what I mainly do in my practice, you can use with nice combination with all other treatments. The main answer you will observe in your practice: nice hair regeneration, nice hair density, very less hair loss. It is what you can observe in the first part of your treatment. So very good reference in your practice. I think you have to introduce Cellbooster Hair to answer all your patients' problematic about hair. Thank you so much. Now we can part with, if you have any questions, with a question and answer, of course, I'm available to answer. Okay, so about questions, I saw 4 questions. Okay. First one. Okay. Can I answer in direct, Nina?
Yes, you can answer orally.
Okay, everybody sees the questions. Yeah. Everybody sees the questions. Yes,
yes.
Isn't it? Yes. Okay. So first question, Kholoud Elmeki. How can I use exosome for the max efficacy for my patient? Should I use it with microneedling order, also mesotherapy, micro injections? Okay. So thank you for your question. For example, what I saw in scientific studies and how I use in my practice, what I suggest, what I advise you, my patients, or you can use separately. You can do one session of exosome. For my part, I use exosome with laser because I have in my clinic the laser D, but if you don't have, you can use with microneedling. It's very efficacy. I use for my part with Dermapen, microneedling and Dermapen 4. So you make a passage of your Dermapen, and after having make a dilution of your exosome with hyaluronic acid, you can apply just after your laser or after your microneedling your exosome. You can do both protocol, what you saw in studies. You can use mesotherapy in the same session just after by needle injections, or you can use mesotherapy in other session, separate session. I advise you 10-15 days after. And you make like treatment with protocol where you can do the same session, for example, 3 sessions of exosome and 3 sessions of mesotherapy. If you do the same time, you can do 6 sessions of exosome mesotherapy and after 6 sessions of light therapy, for example, but you can do it at the same time. I cannot advise you to do all separately or at the same time because in scientific studies, we saw both. So as you want. Okay, second session, spectator anonymous. Okay. Have you ever combined Cellbooster Hair with Kenacort for treating male or female pattern hair loss? If so, how was the outcome in terms of efficacy and tolerance? Okay, no. Sorry, in my practice, I never use in the same time Kenacort with mesotherapy. For example, for alopecia areata, I already use Kenacort, but I do in different sessions. I do first my Kenacort treatment between 2 and 3 sessions with 1 month between each sessions. I wait to see if I have any response, any results. I wait minimum 1 month, and after I start my mesotherapy protocol. Okay. Other question. Can we combine Cellbooster with PRP? Of course. Of course, as I told you just before about the combination, you can use mesotherapy and PRP. It's a very good combination. For my part, I can do, and I do in the same session. You can see in studies or do in the same session or do in separate session. This is 2 different possible techniques. for my practice, I do in the same session. I use, for example, microneedling and PRP, and after I do mesotherapy, both technique. I do mesotherapy, injection needle, and microneedling introduction. So yes, you can do. Hi, thank you, doctor. How to choose combination therapy? Oh, very good question, and very difficult for me to answer you. Why? What you have to think is that when you have to choose combination therapy, how I work in my practice, first, I read scientific studies. What I've done before, what are the good combination in which hair problematic indication. And after, it's with your practice. Because, for example, in my practice, I use many combinations, but not all combination works in all indications. So this is reaction of scientific studies results and combination in your practice. So very difficult for me to answer your good question. But what I tell you, PRP mesotherapy, good combination. Exosome mesotherapy, very good combination. And Dr. Denis hair filler mesotherapy, very good combination. This is mainly what how I work in my practice. Okay. Answer. Does Dr. Denis product include corticosteroids? No. Dr. Denis, it's biomimetic peptides. It's growth factor like EGF, VEGF. You don't find corticosteroids inside. Okay, Pari Amzi, thanks for your brilliant presentation. Okay, thank you to you, and thank you for being here today. This is a very nice presentation for me, and it's interesting for me to talk to you today about mesotherapy. I like your questions at the end because it's a real exchange of our practice in many different countries. So this is interesting, and thank you for your sentence. Other question, Alina Nicolsea. Sorry if I don't say good. Nicolsea. Can I use Cellbooster Hair combined with PRF? Okay, yes, you can use. I don't use for myself, I don't use in my practice PRF, but I know many friends of me in Nice, South Africa, use, and you can use. It's like PRP mesotherapy, PRF mesotherapy, very good combination. You can do same session or different sessions as you want. Okay, Muhammad Ake. The question for alopecia areata treatment. Yes, like I show you at the end of the presentation, picture of patients I treated with alopecia areata. I use Dr. Denis hair filler with mesotherapy Cellbooster Hair with light treatments. I did many sessions. You have to say, and you have to know in alopecia areata, you have to do many sessions. I did until 3 to 6 sessions of Dr. Denis and 10 sessions of mesotherapy. So this is a long treatment. You have to say your patients, this is a long treatment, but we can observe very good results. Okay, Said Yari. Also, what is the protocol of use for hair transparent? I think it was hair transplant. No. Okay. Okay. In my practice, I do hair transplant. This is a big part of my practice today for 6 years. So I can tell you what I do in my practice according to the scientific studies. When I do hair transplants, I love use Cellbooster Hair. You have to use 1 month after, then 3 months, 6 months, 9 months, and 10 months. So I do 5 sessions every 3 months. And just after Cellbooster Hair injections, I use light treatment. I use photobiomodulation. So this is very good to give good nutrients to your hair grafts. and to have a better density after your hair transplant. So I advise you to use after hair transplant, of course. Okay. Okay, so Kholoud El-Mekki, do you have experience with exosome ASCE hair with Morpheus 8? Okay, yes, also, of course, I use exosome with LaserMD, which is a non-ablative fractional laser. I use with microneedling, Dermapen, and I use with Morpheus 8. What I can tell you is Morpheus 8 will be a little bit more painful than the microneedling and than LaserMD. So I use less frequently, but I use very good results. I advise you to use, yes. Okay, nice question. Can I do combination of exosome and Cellbooster in safe sessions? Of course. Of course. This is what I do mainly in my practice. Yes, of course. I do first microneedling, after exosome, after Cellbooster, both technique, Cellbooster used with microneedling and Cellbooster injections with needle. This question I don't understand. This is not English language. Okay. Lisa Reula, have you ever had a patient that didn't get any result from Cellbooster hair? Yes, it appears. For example, for patients where I did only Cellbooster hair, you can observe no enhancement. So this is important, interesting to know that to mix treatments. Before, in my practice, I use Cellbooster alone. But I observe that creating combination, you have better results. So very important to mix Cellbooster with other treatments in your practice. Other question, can we inject exosome directly in the derm? Okay, good question. No. In France, I don't know in other countries the legislation, but in France, we have a strict legislation. We cannot inject exosome into the skin. You have to use a different way, laser, like LaserMD, like Photona, microneedling, or Morpheus. For example, it's a good solution, like radiofrequency microneedling. Okay, and the last question, Nina, I don't understand. I don't know if you can translate. This is Turk, I think. I don't know.
In English, it will be, can the application be done with Dermapen?
Okay. Yes, of course. Cellbooster hair, in my practice, for every session, I use with two ways. First of all, I do first passage of microneedling. After, I use a part of the yarn to apply, to introduce Cellbooster hair in the hole created by microneedling. And the other part of the vial, I put in a syringe, I use a needle, and I inject with my needle. So I use two techniques in the same session, so yes. Okay, I think no more questions. Nina, I think it's okay. If you have any other questions?
No, there is no more question.
Okay, it was very interesting, very interactive. Okay.
I think we can end the webinar.
Okay, thank you everybody for having been here today. And I wish you the best in your life for everybody. And I wish you, everybody, good work with good products. And Swissad is here and nowadays present to give you good products. So think about it. Take care and maybe see you next time for a next webinar. Thank you. Bye-bye.